Welcome to If You Know Someone with a Vagina.
Or as we like to call it, IYKSWAV.
IYKSWAV. Hi, I'm Sandi.
And I'm Beth.
We're recently retired nurse practitioners, excited to bring you a podcast filled with informative insights, compassionate discussions, inclusive perspectives, and expect a healthy dose of humor. Whether you have a vagina or you know someone who does, this is the podcast for you.
The content of this podcast is provided for general informational and entertainment purposes only and is not intended as, or should it be considered, a substitute for professional medical advice. Hey, Sandi, I bet our listeners are itching to know what's coming up on IYKSWAV's Yeastie Girls episode.
Funny you say itching. We'll first introduce you to some yeasty basics.
Ooh, part 1. We're going to share with you our own encounters with vaginal yeast infections.
Yeah, this is something we all would normally only share with our best vagina-toting friends.
And now we're going to share it with you, our new friends and listeners.
Yeah. We also detail the most common symptoms of vaginal yeast infections and how to prevent them from even happening.
Aw, bye-bye sweaty yoga pants.
Oh, and maybe the sugary juices too.
Part 2, what are our partners thinking?
Our survey says...
Ooh, this might surprise you.
It really surprised me.
Ooh. And then part 3, the inside scoop from a seasoned medical provider.
Aw, that must be me. I'll tell you how to go about finding the right provider during your urgent situation.
No, I never see your dimples, your softness or your wrinkles. They are beautiful to me. Beautiful to me. I am beautiful.
In today's episode, Yeastie Girls, we're discussing vaginal yeast infections. Just so you know, yeast infections can occur almost anywhere on or in the body. You've probably heard of athlete's foot or jock itch. There's even throat and lung yeast infections. But today we're focusing in on yeast infections of your vagina or the vagina of someone you know, like, or even love. This is a very common treatable infection and is not considered one of those sexually transmitted infections. There is nothing to be ashamed of. There's nothing dirty or wrong about having a yeast infection.
First, it's crucial to understand that a vaginal yeast infection is an overgrowth of a fungus called Candida. Now, Candida is a type of yeast that normally resides in various parts of our body without causing harm. Candida loves warm, moist environments, so some common locations where Candida can be found is our mouth, our intestines, armpits, groin, and of course, our vagina. But it's kept in check by good bacteria in our healthy immune systems. But sometimes things get out of balance from common occurrences like taking antibiotics or other medications, hormone changes, and sometimes even your diet or clothing choices. But let us assure you, vaginal yeast infections,
So incredibly annoying.
very annoying, are very common and treatable. Part 1, the patient perspective. And duh, we're patients too.
Has this ever happened to you? Let's get personal.
Ooh, Sandi, tell me about your yeast infection.
Okay. So, I don't remember exactly how old I was, but I do remember it was super early in the morning, super groggy. I'm a clock watcher, so, one of those one eye open and, do I have to pee or don't I? And so while I'm thinking about it, I'm like, oh, something feels a little off. So it's just like, is that irritation down there or itch? Yeah, I'm not sure. So I'm like, okay, I don't want to wake my partner up. So I'm just going to head or tiptoe into the bathroom. And I'm not going to turn on any lights, but I'm going to take my phone for a flashlight.
Just picture.
Yeah. Or picture. I didn't think of that. Darn. Yeah, I could have done that. Yeah, then it's in the cloud and, anyone can get to it. No.
Look what I got.
Yeah, oh no. Whose vagina is this? So my vagina could be famous. But yeah, so I got that big awkward mirror that you can plug in. There's a light on it. It's a flip mirror and it's just like way too big and awkward. So
It's huge.
Yeah, it's huge. Gigantic. And so I put it on the floor and laid it there. And then I'm just like, okay, now I have to kind of straddle the mirror and then shine the phone flashlight into the mirror. Yeah, every time I'm going to check myself out. So I just put it at the mirror and then it lights it up for me. So I'm looking and I'm like, oh, holy crap. White spots.
Oh, God.
Never had that before. So I'm like, what the frick? And so I'm thinking the worst.
Yeah.
So white spots, what's that? HPV? Warts?
No. Yeah.
Like, holy crap. So I touched it and I'm like, oh, thank God it moved and it wasn't fixated and it came off. So I'm like, hallelujah. But by that time, it's like, this is really starting to feel like some ants down there.
Ooh.
And just like a few dozen,
I don't.
not the fire ants, like that. Not yet, anyway. So just starting. It's like, gosh, what did I do? What is it? This is off for me. So because it's so early in the morning, I'm like, everything's closed. So it's like, I've got to go get it checked out. So at the time, I did end up calling, once it hit like after 8:00, an urgent care, and I was able to make an appointment.
Oh, wonderful. Do you remember, did you say anything to your partner? Do you remember?
I did not.
Yeah.
I just still wasn't comfortable at the time, and almost like shame on me.
Well, because you do. You don't know what it is. It's terrifying.
And, they could have noticed something and not said anything either. Like, if we did have intercourse that night, it could have been, something could have been sticking on his penis too. And he might have been saying like, well, what is this? Or maybe he knew already. Like, what if he said, hey, you got a yeast infection. I just diagnosed you because I went to the bathroom to clean up.
Wow.
There it was.
Astute.
Hey, wow. Yes. Only date smart, man.
Good. I love it. Life lesson. Life lesson.
So how about you?
Well, mine was back in the day, back in college. So quite a few years ago. And I was young. And I remember not knowing what the hell was happening. All I remember, there was a lot of burning, a lot of itching, incredible discomfort. And of course, I'm freaked out, right?
Yeah.
What's going on? And thank goodness I had a good friend who had a yeast infection. Not
the best friend.
Right?
Yeah. The ones that...
Yeah, they know what's going on.
Yeah, I've had it.
So, and, good enough for me, I can be like, oh my God, my crotch is on fire. What do I do? You know? And so she's like, oh, I got your back. It's a yeast infection. Go get some ice from the fridge or some peas, frozen peas. And,
what a great friend. Oh, yeah, the ice. Yeah.
Just for some nice cooling down there because it was on fire.
Yeah, but not directly on the skin, just so you know.
Oh, okay. Thank you.
Yeah.
Thank you, nurse practitioner Sandy.
That's right.
Because you don't want that's tender bits down there. You don't want some ice, right?
Very tender. Yeah, make sure you got a couple layers of cloth in between.
And then once again, this friend she had known to go to the pharmacy, and over the counter you can actually get some cream for a yeast infection. And luckily she told me that because I did not have insurance at the time. So I could not make a appointment with a provider.
Yeah.
Or it would have cost me, an arm and a leg. So I was so grateful I had this friend. And I was able to get the over-the-counter, I think it was Monistat, it's what I got.
Yeah, that's been around a while now. Yeah.
And I guess it went away because I don't have it anymore.
The 20-year itch. Oh, no.
But unfortunately, that happened to me. And I certainly, anyone out there who gets a yeast infection or any kind of, oh God, what's the word I'm looking for? Any kind of concern, you would definitely want to reach out to a healthcare provider.
Yeah, especially if it's your very first time. you've never had it before, you don't know what it is, because it could, there are other things that make you itch and burn.
Yeah, absolutely.
So you definitely want to not guess. But the other thing that I know you would have done anyway is if you do the treatment, whether it's 1 day, 3 day, 7 day treatment, because they have different ones, and then the symptoms persist or get worse,
Ooh, yeah.
you got to go in.
Absolutely.
Yeah.
So thank you. Mine was cured.
Okay, kids. Quick overview of our anatomy and where the yeast infection we're discussing today most commonly occurs and may spread to: the vagina and the vulva. These are important parts of our privates.
Our bits.
Our bits. The vulva is the outer part, while the vagina is the inner part. So the vagina is a muscular tube that provides for items used for sexual pleasure. It allows for insertion of tampons or menstrual cups, and for some serves as the birth canal. Just above the vagina is the place where you pee out of, called the urethral meatus.
Pee hole.
That's right. Above that is the clitoris that really enhances sexual pleasure and is about 1,000 times more sensitive than a penis.
That's crazy.
I know, lucky us.
Right?
Thank goodness the vulva protects those inner structures with 2 sets of labia or lips. The labia majora, the outer folds, and the labia minora, the inner folds. Can you imagine if the clitoris just flopped around like the penis?
Ew, Sandy.
I know, but if it didn't have that protection and how sensitive that would be.
Woo.
Ooh, boy. So thank you, vulva
Aw.
and labia, for doing your job. Before nursing school, I had heard that there were 3 holes down there, but I thought I peed out of like where the clitoris
Yeah,
is.
I think a lot of people.
That really?
Oh, yeah.
Oh
Come on.
my gosh.
It's got to be a common
I hope so.
misconception. Yeah.
I know. So after having kids or just losing tone in that area.
Kegels.
Mm-hmm. So it seems to me that pee hole, as you call it, seems like it falls down and then it's like practically inside the vagina.
Yeah, right.
And that's why, it does get said sometimes that we pee out of our vaginas, but we're not actually peeing out of them, but just that, that pee hole area just kind of drops and loses the tone. And so it's like,
Speak for yourself, Sammy.
I know. Well, I kind of am.
Doing a Kegel right now.
It's like, that's right. I did. Every time I taught a Kegel, I did my Kegel. So, when I was actually doing exams and appointments, I think I probably had a lot better tone. So since I just was talking about the anatomy, I think talking more in depth about the symptoms would be good. So what are some more common symptoms?
Yeah, because we discussed some that we had in our own stories. But some of the most common symptoms of vaginal yeast infections include itching, burning, soreness, redness, irritation, pain with intercourse, and pain while peeing, usually on the outer parts when the infection spreads to the vulva area, like we just talked about.
Yeah, stings.
Poof.
Yeah.
Sometimes there is a discharge or drainage from the vagina. The discharge is classically white, thick, and adheres to the walls of the vagina. It can be clumpy, curd-like, or cottage cheese-like.
Okay, I know it looks like cottage cheese, but we
really
don't.
does.
We don't want to ruin an entire food group.
But it really does look like cottage
It really does. It really does.
And with no or minimal odor.
Right.
However, not everyone gets a discharge. So, or the discharge may be thin and loose because the intensity and signs and symptoms vary from person to person, from very mild to pretty severe. So
Yeah. So I think my first one was really on the mild side.
I'm going to call mine severe because I'm a baby. But
well, I don't think you're a baby. I think you just had one.
It hurt.
Yeah. First timer severe infection.
It burdens us.
Yes, unfortunately. So risk factors also we just wanted to touch on that can actually make some people more susceptible to getting a yeast infection. So it includes people with diabetes because that's where the blood sugar levels are high and it's not well controlled. Yeast loves sugar, actually. It's like, feed me sugar and I will grow and grow and grow and multiply. So, and sometimes it's like your body can start making itself crave sugar.
Because the yeast controls us.
It just, I mean, it's the microbiome and all of that stuff. So, what's another trigger?
Antibiotic use.
Oh, yeah.
So antibiotics not only target bad bacteria, but also can affect the healthy bacteria that's part of the vaginal microbiome.
Yeah.
As Sandy was
What is
talking
it
about.
again?
What is a microbiome, you ask?
Hard to explain.
Google it.
Yeah.
No, it is fascinating. It's the bacteria, viruses, fungi, and other microorganisms that naturally live on and in our bodies.
Yeah.
They play a big role in how our bodies work and stay balanced. So when the healthy bacterial population in our vagina decreases because of taking antibiotics, then the potential for a yeast infection increases. So we understand a common practice when taking an antibiotic is to also take a probiotic, like a pill or eating yogurt.
Right.
However, the evidence is still kind of vague on whether or not it's truly effective. But you know what?
Yeah.
It's not going to hurt.
Doesn't hurt.
I did it last time I took antibiotics. I took a probiotic.
I would do it too.
Guess what? No yeast infection.
Yeah. So, are they really going to spend a lot of money doing research on that?
Well, once women are in charge, yes. Yes,
Actually,
they will.
With you, babe. So another thing that's important to know is the fluctuation between hormones. So can also put you at higher risk, which is like, what?
Well,
I don't know. It just kind of sucks because it's like estrogen and progesterone. And so those are actually really important to keep that vaginal microbiome balance. So natural fluctuations in these hormones can affect the vaginal environment. So, for example, someone who's pregnant, someone who's just having periods. So that stuff fluctuates throughout every month, right? And then also if you're just taking extra hormones, and that could be for contraception or even postmenopausal or perimenopausal. And all of those examples can actually increase your risk for vaginal yeast infection.
Great.
Unfortunately, I know.
How about another risk factor for you, Sandy?
Yeah.
How about when your immune system is suppressed because of certain medical conditions like HIV or taking medications such as steroids?
Yeah, so that whole immune system thing, stress and all that kind of stuff.
Wow,
It's just so many things affect your immune system. And that's, we're coming into Christmas time. Like, my hair is starting to fall out. It's like more in December than any other month. It's like, I love it so much, but there's a lot to do.
Yeah.
And, trying to get that perfect gift. Don't I was going to make a herpes. Herpes is the gift that keeps on giving.
That's another episode. Thanks.
Yes. Woo! And that's actually a sexually transmitted disease, as a yeast infection is not traditionally considered a sexually transmitted infection because yeast is found normally in our vaginal microbiome, which we keep saying because it's talked about so much. So we're just trying to introduce it into conversation to just make it sound much less foreign to all of us.
It's so important.
Yeah, it is. It's amazing. But that doesn't mean it can't be transmitted with sexual activity. So if you have an active yeast infection, you could possibly transfer the yeast to your partner. And even when I was seeing patients, I definitely would ask about the history and how are their partners doing. Because if they come back within a month, it's like, okay, what happened? And then we really start getting into the partner scene and say, well, listen, I'm totally willing to treat your partner. So if you think they have a little rash going on, but they didn't think it was anything or yeast, or maybe they didn't tell you. Have the conversation.
Have the conversation.
It's like, be braver than I was when I was young and, didn't talk about it. And I'm happy to treat them. Like, just let them know first. I'll give them a call. I'll make sure they don't have any allergies to the medication that we'll probably just give them a diflucan. One pill, one time is usually the treatment. So depending on the severity of it, or if they have a widespread rash, they may need a longer treatment. But I'll call them up. We'll send it to whatever pharmacy that they want. And then, no touchy during treatment.
Can I tell our listeners, Sandi, because they don't know, that you were a nurse practitioner in women's health for many years.
Yeah.
And that you have seen many, many, many vaginas.
I would say tens of thousands.
Holy, that's a lot of vaginas,
yeah.
Sandi.
And they're all different.
Yeah.
Yeah.
So I just want you to know, Sandi's she's got clout, baby. She knows what she's talking about.
It's like, I don't remember everything because I'm getting old, but I'm still trying to kick it. But, that's what Google's for.
Giggle it.
You can look stuff up. Everybody does.
Everybody does.
No shame.
And although there isn't really clear evidence to support a link between vaginal yeast infections and bad hygiene practices.
So important to know.
Habits such as douching, don't douche.
And don't be a douche.
Good points. Don't be a douche. What else? Leaving a tampon in or wearing a menstrual pad for too long, longer than like 3 to 4 hours.
Yeah, let's not live in a panty liner, please.
Live in a panty liner.
It's like sitting in plastic all day. Yeah,
and that's that warm, moist environment that the yeast love.
Oh, yeah. It's the worst.
And you know what else? Warm, moist environments yeast loves? Tight, sweaty yoga pants, things like that.
Yeah, after yoga, don't go run your errands.
No, or change.
Just please
put some cotton panties on there.
Yeah, I know. It's like you're picturing old lady panties, aren't you? All of you are. I just know it.
They're the most comfortable.
They're the best. They're the best. But yeah, just got to be careful. And cotton is the best.
Let your vagina breathe, ladies.
She's got to breathe. Yeah. I mean, she may be a self-cleaning oven, but you got to help her out. Gotta help her out. Come on. Give her a break.
And as Sandi mentioned before, too, eating too much sugar could be a risk factor. Because remember, Sandi, what? Yeast love sugar. So what's a good takeaway for our listeners?
Well, I think the takeaway for this section is if this is your first bout of itching, pain, burning, or any new vaginal symptoms, please see a medical professional because more than one type of infection can occur at the same time. Or you can have overlapping or similar symptoms. And even more important is to see a professional and get tested so you know what you're dealing with and you can get the appropriate treatment.
Good takeaway.
Part 2. Survey results, your perspective, and your partner's too.
Okay, so we surveyed some people about yeast infections. Actually, we surveyed about 50 people between the ages of 18 and 65 years of age. 67% of survey respondents or their partners had experienced at least one vaginal yeast infection.
That's a bunch.
When asked what they were afraid of hearing from their partner after sharing that they had a current yeast infection, most were along the lines of, they didn't want their partner to be like, ew, gross, haven't you been washing? Get that fixed so we can have sex again.
Yeah.
Yeah, right?
I think that probably went through my mind when I had mine.
Another, who have you been sleeping with? Because although we know it's not sexually transmitted, not everyone does. Or it's no big deal. You're exaggerating. Get over it.
Right.
Is it contagious? So these are things that people were concerned that their partners were going to say to them. But really, in contrast, when we did the survey, 77% of the partners actually said that they would want to know if their partner was experiencing symptoms of a vaginal yeast infection.
Wow.
I know. And that they would try to be understanding and want to be helpful. So I guess we have to give our partners more credit, don't
Yeah.
we? We found it very interesting that the stories of those of us affected by vaginal infections and the response of our supportive partners is quite different.
Yeah, I mean, the things that we tell ourselves, like all the people said that had the yeast infections, I mean, we really are not that kind to ourselves.
I know, that's so sad.
Yeah.
So be kind to yourself.
Yeah.
Because your partners, from the responses, they seem to know that being supportive and understanding is key. You know, they want to know how they can provide comfort, and they realize this is not a time for sex.
Yeah, closed for business.
Another thing we surveyed was how long into a relationship would you feel comfortable sharing health issues like a vaginal infection? Like Sandi, she didn't want to tell her partner.
Yeah.
But over 50% said less than 6 months.
That is a new generation.
Right? Good for you.
Yeah.
And over 32% said 6 months to a year. So
yeah, times have changed. That's amazing.
Part 3, the provider experience.
What can we expect from the provider experience? How do I get a provider? These are at least a couple questions that I know everybody has, because we've all been there at different ages, and it's like, I don't even know how to manage this whole
access healthcare.
Yeah, access the whole system. It's confusing.
It's confusing.
So should I walk in or should I call ahead? So first of all, it may seem like an emergency when you have a yeast infection.
Of course.
It's like, should I go to the ED, which is emergency department? Used to be ER, so emergency room, but they just love changing those acronyms. So the patients are seen by what we call a triage method. So you remember that from school, right?
I used to work in the ER.
Oh, you did? So
I don't want to self-brag.
Triage. Yeah, I did not know that about you. That's fabulous. Yes, I never did emergency room.
I didn't care for it.
Oh, I actually remember as a student, the first time I was in there, I was like standing there, like waiting for something or somebody to tell me what to do. And this person just had like projectile vomit.
Oh, yeah. And you're like, out of here.
Like, ew. Oh, of course. Can you go clean that up? Oh,
Student.
Okay. Yeah, I'm not working here. But anyway, so the triage method is the person with the heart attack, the stroke, the car accident, the knife sticking out of their stomach, or whatever is going to be seen first.
Be seen before my yeast infection?
Yeah,
what?
Yeah, but your vagina wanted to be treated like yesterday, so it seems like an emergency. So your would-be 15-minute exam turns into a 4, 5, 6 hour wait.
Yeah.
Yeah. So try it in this order. So this is my recommendations to be seen. So, of course, again, and if it's your first time ever with a vagina problem, you first should call your primary care provider. We call those PCPs, primary care provider. So this is your family doctor, your nurse practitioner, your physician assistant. So nurse practitioner is NP or physician assistant is PA. So if I say those acronyms again, you'll know what I'm talking about. So these are the people that you normally would go to for those non-vagina related checkups, right?
Like blood pressure.
Yes, refills of chronic prescriptions, your immunizations, or if you're just ill. So, like you're going there for your bronchitis, your sinus infection, or whatever. So they may or may not do vaginal exams. But you know what they do know?
What?
Who to refer you to.
I like a good referral.
Yeah, and this is someone who I trust and who does these types of urgent visits on a regular basis. So they know and feel comfortable doing vaginal exams because, some will, but they're like, well, I haven't done one. And
well, you may not be comfortable having your primary care physician do a vaginal exam.
Right. So. Exactly. Good point. Yeah. So it just depends on the person for sure on either end of the speculum, so to speak. So number 2 is if you already have an OBGYN, which is obstetrician/gynecologist, an NP, a midwife, or a PA that you've seen before. So they're already prescribing your birth control or they're already doing your pap smears.
They've already seen your vagina.
Yes. So then you don't need to introduce your vagina to somebody new.
Nice.
Which I prefer that myself. So plus they already know you. It's likely a visit that they don't mind squeezing you in on occasion, even with a full schedule, because they know your history and everything like that. So it makes it much easier on the provider also. So number 3 is the urgent care, which is where I went. So let's say the first 2 options don't pan out.
Okay.
And in a timely manner, which,
right? Like I was going to say, if it's like after hours.
Yeah, how long
the urgent
can you
care
wait?
Is still open, yeah.
Right. So because instead of just walking in to the urgent care, or like you would in the ED, there's actually most of the clinics, or a lot of them, will allow you to call and make an appointment.
That's great.
I know. It's like the best kept secret. And so if you call, then they probably will have appointments in the afternoon. So the morning is kind of for people who get up early. They don't care if they have to wait in line.
You probably have to get a work note for sick note.
Yeah.
Right.
Always there's tons of those. Well, I actually worked in an urgent care for 4 years, so I wrote a lot of notes.
You know what, Sandi?
Yeah.
I did know that.
You did. Okay, you're keeping track. All right. I love it. So, so it's very interesting working in an urgent care. But so this morning time is first come, first serve. They don't really triage there because the sickest of the sick
are going to the ER.
They should be going to that emergency department. So now it's first come, first serve. And so you don't want to be sitting there with the rest of the hackers or whatever they're coughing or whatever. And then you're just sitting there crossing and recrossing your legs until you
scratch.
Yeah.
Scratch one out.
It's just so uncomfortable. So if you can stay home, put that ice pack on, don't put anything in your vagina before you go in, if at all possible. So when you go to the urgent care, sometimes they don't even do an exam, so to speak. They might like hand you a swab, which is like the fancy name for a Q-tip with a long handle on it, and you could put it inside your own vagina. And if that happens to you, just make sure you put it back in the back third of your vagina, and then just go around in circles for about 5 seconds and go against the vaginal wall.
It's a COVID test.
It's like, I totally say that. Yeah, I get it. But remember the first COVID test?
No,
they were so deep into the nasopharyngeal area, which was way back further than anyone knew until they actually had to get one of those tests, and it was so uncomfortable.
Well, okay, so on that note, with this swab, you don't have to shove it all the way.
Well, yeah, so remember
your vagina.
Your vagina's not a bottomless pit, so it will end. And so it's stretchy.
I'm sorry, I need a moment. Okay.
Yeah, so you put it back in the back third, so you don't have to go in like until it stops, but just put it in as far as comfortable.
Okay.
Imagine it's the back third of your vagina, and then just like swirl it around like 5 times. But they should be giving you instructions, just like here's
a swab. Do with it what you will.
Yeah, whatever you want. So this test is usually called a vaginitis test. Now it used to be called a FIRM, was the name of the test. And so it actually tests for the 3 most common vaginal infections, which is yeast infection, bacterial vaginosis and trichomoniasis, which
See
is
next episode.
Yes, down the line called What's That Smell? Well, both of those last two could cause a different type of odor. Thank you very little. And so the test result is generally available the same day or the next day. And that depends on the clinic's relationship with the particular laboratory that they'll be using.
Okay.
So when I was doing exams in the urgent care like this, I often got results the same day, but for sure the next day. And so as soon as I got it, I would be calling them up so they knew and we could get information to them right away.
Hey, Sandi, that was really great information on what to expect if you're being seen for a vaginal yeast infection.
I hope so, because I remember, before I ever went into it, have any kind of exam or issue, I really wished I would have known a lot of this information. So if I could help even one person, between you and I, I'm pretty sure that's what we're going for.
That's what we're going for. And speaking of, for listeners who want to know more information about what to expect during like a full pelvic exam or what the exam entails, we have a great podcast to listen to.
Yeah, it's called The Pelvic Pokey, the ins and outs of the pelvic exam. Of course, it has to be funny.
And the listeners, it's a really good one. Trust me on this one. You gotta listen. All right, listeners, quick summary. Are you ready? A vaginal yeast infection is a common fungal infection caused by an overgrowth of Candida. It occurs when the natural balance of bacteria and yeast in the vagina is disrupted.
Yeah.
Common symptoms include itching and irritation in the vaginal area, thick white cottage cheese discharge, vaginal redness and swelling, and pain during urination or intercourse. Some possible causes can be antibiotic use, hormone changes, diabetes, weakened immune system, and wearing tight, non-breathable clothing.
Yeah.
Treatment includes antifungal creams or oral pills. The inside creams and the outside creams are different and specialized for those areas. So remember, don't be putting your dad's athlete's foot cream
Yikes.
in or around your private parts. Get the one specifically for a vaginal infection. And prevention includes maintaining good hygiene, keeping the vaginal area dry, avoid unnecessary antibiotic use, and reduce sugar intake. And as always, if symptoms persist or worsen, consult a licensed healthcare provider.
Agree. I'm Sandi.
And I'm Beth.
And if you have a vagina or know someone with a vagina, then please like, share, and send them our way. Go ahead, spread it around.
Feel free to spread it.
You can find us on all podcast platforms like Spotify, Apple Music, and YouTube.
Bye, everyone. Thanks for listening.
Spread it around.
Feel free to spread it.
You can find us on all podcast platforms. Platform.
Okay, I'm sorry.
Stop it.
Okay, Jesus. Stop it.